30 p.m. here in Seoul. I'm Devin Whiting at the Arirang News Center, and it's time now for today's briefing from the South Korean health authorities that's scheduled to begin any minute now. We should be getting a breakdown of the numbers and as well as some other potential new measures. Let's listen in.
Hello, I am the first Vice Head of the Central Disaster and Safety Countermeasures Headquarters, Minister Bang Neung-hoo. As of midnight of today, there were 1,072 newly confirmed cases, and in the metropolitan area, there were more than 770 cases. Yesterday, 15 people passed away. We pay our respect to the deceased, and we also pay our condolences to the family members. Since December 16th, we have maintained a 1,000 level for the newly confirmed cases, and we are at a very grave situation. Over the past week in Korea, on a daily average, there were 995 newly confirmed cases, and there were around 668 cases newly confirmed for the metropolitan areas on a daily average. We have increased the number of tests. However, the number of patients are still over 1,000. However, we are not seeing a sharp increase. However, we are at a serious situation because the number of patients are not decreasing either. I believe that this week, including the next few days, will be the most important inflection point, and the government and the citizens should come together and have concerted effort to overcome this crisis. We ask our citizens to continue to wear masks and to prevent from going outside, and we also ask you to adhere to social distancing. We are going through tracking and isolation, and I want to update you on the status of it. The government, for the countermeasures, is maintaining it very robustly, and we are aggressively increasing the number of tests, and we are going through the epidemiology research and going through isolation so that we can quarantine any further infection spread. We are operating more than 120 screening centers, and we have tested around 44,000 people just yesterday. And until now, for the past few days, we have tested around 160,000 cases, and we were able to find several patients in advance. And yesterday, we have also done a lot of tests, and over the past week, we have tested more than 60,000 on a daily average, which amounts to more than 400,000 for the week. And we have also strengthened the number of people who are participating in epidemiology research. We are trying to rapidly take care of it so that we can find patients in advance. And we are making efforts so that we can recover our medical facility. And through this, we are able to find some preliminary cases. And if we were to maintain such an aggressive testing and epidemiology research, we believe that we'll be able to slow down any further spread of the infection and the community spread. And we ask our citizens, if you're suspicious even by a little bit, then for yourselves and for your neighbors and for the loved ones, please get tested actively. For the screening centers, it is also being operated at night times and in holidays. And we also have anonymous testing, and you can also test through your saliva. For the hospitals, we are also making efforts to expand more hospital beds, and we are trying to gain more a little by little. For the medical response system, for the securing of hospital beds, it is lagging compared to the newly confirmed cases, and it is not sufficient right now. And in securing hospital beds, we had taken time with the previous patients, and we didn't have efficiency in assigning the hospital beds to the patients. And we believe those were the reasons. Therefore, if we were to see a continuance of more than 1,000 newly confirmed cases on a daily average that we see now, we will have to improve the efficiency in assigning the hospital beds. So we are going to make efforts. First, with the securing of additional hospital beds, last Sunday, we were able to secure more facilities, and we have updated you on a plan to secure more than 10,000 additional beds. And we have secured more than 500 beds in certain hospitals, and also we have secured more hospital beds for those who are critically ill as well. And other than the ones that we are securing in local governments, we are also operating 2 more life treatment centers. And for the metropolitan areas, in order to decrease any waiting time, we're also going to have life treatment centers, hubs, in both the northern and southern areas of Seoul. For these hubs, these are centers that are strengthening the medical supplies. And these are also for patients without symptoms or without any illnesses who could be suspicious. And when there are risks, and for patients who are in the boundaries, we believe that this would be especially helpful. And for the life treatment centers, we have also rationalized for those who are entering. And for those who are healthy and who don't have to be treated in the hospitals, they will be able to enter in the life treatment centers even if they are elderly. And for those who are elderly without underlying illnesses and who are rather healthy, they will be able to enter into life treatment centers. And in the case of exacerbation of the illness, we're going to transfer them quickly to the hospitals. And we're also going to exempt any obligations of the medical personnel in that regard. And also, in order to enhance the cooperation of hospitals, we are also making efforts. So for those patients who are transferred to hospitals and for the patients who are entering into the life treatment centers, we're going to also think about increasing the benefits for those. And we're going to strengthen the existing medical response systems, and we are also continuously securing more hospitals that can act as hubs. And for the National Health Agency, we're also going to transfer all of the hospital beds in those hospitals to those that are responsible for COVID-19. And also there are other hospitals in Chungnam that will act as hospital hubs. And there is the Hyundai Hospital and also the Suncheonhyang Hospital, and they are also participating as private hospitals. And also for the military Daejeon hospitals and Daegu hospitals, they will also act as one. And we're also going to secure more hospital beds. So for the public hospitals that are dedicated to infections, we're going to use them as much as possible so that we can secure 800 more hospital beds. And if the private hospitals act as the treatment hubs, they will have incentives. And we're going to supply around 5 billion won so that we can secure more hospital facilities as soon as possible. And we're also going to compensate for the losses. And for the unit prices of the losses, we're going to make sure that we guarantee more than the actual losses themselves. And for these compensations, it used to be 2 months as standards. However, we're going to expand this criteria to 6 months. And we were also able to enhance the treatment at hospitals. And for those who are over 59 years old, with light illnesses and without symptoms, they'll be able to transfer from hospitals to life treatment centers. However, if these people refuse to transfer, then they will be in charge and they'll have to take the burden of paying for their own treatments. and hospital beds. So we want to ask our patients for your understanding because we are at a grave situation. We're also securing more hospital beds for those who are critically ill. So we are working with 17 public hospitals and we're also working with 42 private hospitals. And over 1% of the permitted hospitals will be secured as critically ill hospital beds. And we have actually imposed an order of that. And we believe that we'll be able to secure more hospital beds for the critically ill by doing so. And also, in order to support the securing, we're going to exempt the assessments for some hospitals that used to be very strict before. And we're also going to provide some score incentives in future assessments. And in public hospitals and for the high-level hospitals, they will be having difficulties. However, considering that it is a very serious situation, we want to ask you to actively cooperate. Also, against this backdrop, we are also assigning the hospital beds for those who are relieved from being critically ill. And these hospital beds are also guaranteed for those with high risk. And through the items that I have explained now, we believe that we'll be able to secure more hospital beds gradually. And as of yesterday, the operation rate of Life Treatment Center is more than 40% in both the metropolitan area and for the entire country. And based on the metropolitan area, for those hospitals who are not critically ill, there are 4,900 people, and in total, we still have room for around 5,500 more patients that are not critically ill. We're also going to make sure that we effectively assign hospital beds so that we can minimize the number of waitings. And for the hospitals that are dedicated to the metropolitan area, we have decided to actually transfer the authority to the Central Disease Control Headquarters so that we can minimize any burdens or any issues. And we're also going to have 2 doctors and 10 more personnel in the task force team. And we're also going to have more than 50 doctors additionally participate. And by doing so, we have seen a decrease in the number of waitings in the metropolitan area, and we're going to continue to decrease this in the future. And there are 368 people who have waited for a day before being hospitalized, and compared to more than 500 from the previous day, there was a decrease. And next week, we'll be able to secure more hospital beds, and we believe that we'll be able to enhance efficiency. So we believe that we'll be able to meet the number of required hospital beds by doing so. And for other than any special situations, we're going to continue such an improvement so that we can see a gradual expansion of the number of hospital beds. So we hope to minimize any people waiting at home before being hospitalized. And for those who are waiting, we are also strengthening medical system as well. So for those who are waiting to be hospitalized, we are going to make sure to monitor them for more than a month through clinics. And we're going to have dual monitoring with doctors. So a doctor will phone these patients to confirm any symptoms at least once a day. And we're also going to make sure that there's no omissions in monitoring. And in order to do so, we're also going to cross-check the list of those who are waiting. Overall, we are seeing an enhancement in our responses to disease control. And we are securing more room, so we believe that we will be able to see an effect with this increase in room. So we're not going to elevate the level of social distancing to level 3, and we hope that we'll be able to overcome this while not elevating the social distancing level. We ask you to be a little more patient. Christmas and year-end is coming up, and we have faced many difficulties for the past week, and we believe that you probably have a desire to meet with your family and friends who you haven't been able to meet for a long time. However, any gathering or events can lead to risks. Right now, let us hope that this would be the last risk, and we hope that you will stay home so that you can meet more people later on after overcoming this risk. We hope that everyone will make concerted efforts and cooperate with us. The government will also make efforts and strive hard to do so. Thank you.
And that'll conclude our coverage of this briefing. Thank you for watching. Arirang News will be back at 6 p.m. Korea time.